Good morning. Good morning, everyone. I hope you enjoy the conference so far. So, my name is Vi Phan from Houston Methodist, the Baker Heart and Vascular Center. Today, I would like to share our work on the KISS MRI protocol for lower limb venous imaging. So we focus on improving trigger and signal quality in healthy volunteer. Our study is funded by Houston Methodist Research Institute Clinical Scholar Program and also sponsored by American Heart Association, also National Institute of Health Research Project Grant. KISS MRI is well known for arterial, but we it have high diagnostic accuracy, no contrast needed, and robust again motion because ECG gated, single shot, also fast and simple to implement. However, when it comes to venous, it has some challenges as signal drop out at deep vein, also arterial contamination, and triggering difficulty. As you see, this is traditional position for ECG electro. When you do the scan, if you see you have challenges on getting signal, you also can move the green electron to the right side. So for now, you have one on the top, 3 on the left side, but somehow we move the right electron to the right side, right under the white, you also get good signal. But also, of course, it depends on patient habitus. So if patient white, big, then you increase it up, or the electrolyte up. But if they're thin and skinny, you lower it down, again, of course, based on the heart position. So let's talk about KISS technique. According to Dr. Elderman, right after the R wave, there's going to be the trigger delay. For the heart, it will be right at 0 second. So trigger delay is we wait the time to wait to get the signal at the area of interest. For example, if it's the heart, it's going to be 0 second, right? Because the heart always have the bright blood. But if it comes to the lower limbs, it might take about 100 milliseconds. And right after that, we're going to have a 90-degree saturation point, then another saturation, tracking saturation points applied. So QI is quiescent interval. This is where we wait for the blood flow to steady, so no motion. Then a single shot applied to acquire the imaging. This is the result we have when testing. We use the same TR for the first 3 video you have at 650. As you see, we having problem with the signal for the lower deep vein at lower limb from the knee down. Then we try to increase the trigger delay. Then because increase the trigger delay, you wait too long, the signal again die down, then you missing the signal at the end of the slide. That's why you have the zebra artifact. And then, of course, that's the increasing. And then, of course, we reduce the TD, so it trigger delay, so it's too short. We don't have enough signal. Then there's no signal on the lower limb. The four image you see, is where we maximum the TR, so the long, and also increase the quiet interval. So by increase the TR, longer TR, we have enough time for the signal to like steady. Then when we apply the signal, we get good signal. On the top right, but you see, we wait too long, then we got the contamination from the artery. So we don't have a good number to completely just get the venous imaging, venous imaging, but when we wait too long, then we got contamination. So on the top right, we also try with no saturation pulse, and of course we get signal, but both from artery and vein. As you see on the bottom, that's it where standard artery phase, where we like beautifully acquire the vessel without contrast. Here I would like to share some parameter of interest as I shared early, acquisition window. So it's best to wait allow 10% for RR interval variability, so that way when the heart rate not consistent, we still have room for it to take pictures, so it not like skip every heart rate. And for trigger delay at early from heart to the area of interest, at heart is 0, but at lower limb it should be about like 100 milliseconds. And TR as long as it's possible to get the image. We also try on 5 Tesla Jupiter of United Imaging. So the left side you will see the 5 2D. It's all arterial phase. The way it take picture is it take picture of both the artery and the venous phase. Then it subtract the either artery or the venous to get the one we need. On the right side, it's gonna be regular time of flight. Again, this is artery image. Our goal is looking for the venous vein, venous artery, but venous vessel. But because it's still on work in progress, we don't get any good images for the venous phase yet. I would like to thank you, my PI, Dr. Trisha Roy, and Dr. Kamanet for also Houston Methodist Peripheral Vascular Device Development Corps. Thank you. Yeah.